with men in their 20s, in general, the only screening that's routinely recommended that early is cholesterol screening, especially if you have some family history. And then, an annual physical every 3 years or so is usually recommended once you hit there. And then, of course, universities are going to have preliminary STI testing in some cases. But of course, that depends on potential exposure and things like that. But aside from that, from a urologic perspective, again, about the same, particular self-exam and testing as indicated for STIs. I mean, for men, the fortunate thing is they typically don't need to see me for a little while.
Right.
Then suddenly they have to see me all the time.
Right. Right.
Right.
So, Dr. King, in the 20s, what testing, what screening should ladies be going through?
So in your 20s, definitely if they're sexually active, like we talked about, STDs, STIs, we have to start thinking about people. What we don't plan for is pregnancy, right? But a lot of times, people get pregnant when they weren't planning to get pregnant. So it's really good to do those labs before. So if you have sickle cell trait or sickle cell anemia, if we're screening for rubella, we're screening for, so we should have a baseline of labs just screening for those things in case you need to get a vaccination and all those things. A lot of times they come to us as their primary care physician, which I truly believe you should have a primary care physician at OBGYN, and most don't. So we will be screening. You're raising your hand? Okay. No judgment. No judgment. But so a lot of times we do the family history, just like Dr. Acquaye said, and we will be screening for your cholesterol. We'll be looking at the thyroid. We will be doing those things too that are generally typically done with your primary care. And we do that in their 20s. Also in our 20s, and not in terms of screening, but we start talking about vitamin D and calcium. We talk about birth control and all of those things, but we want to start protecting our bones earlier. So when we get to one of my last screenings, the bone density, we're not necessarily increasing our risk of osteoporosis, but we'll come to that as we go down the line.